So we would like to begin our time together with a reflection. So we recognize that our work and the work of our members takes place on traditional Indigenous territories across Ontario. We also wish to acknowledge that the office of the RNAO is located on the traditional and unceded territory of the Huron-Wendat, Haudenosaunee, and the territory of the Mississaugas of the Credit. This territory was subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also recognize that the participants of today's webinar are located in other traditional lands across Ontario. Today, this land is still home to many First Nations, Inuit, and Métis peoples from across Turtle Island, and we are grateful to have the opportunity to work on this territory. By personally making a land acknowledgement, you are taking part in an act of reconciliation, honoring the land and Indigenous heritage which dates back over 10,000 years. We encourage you to learn about the land you reside on and the treaties that are attached to it. Land acknowledgements are an act of reconciliation and we must all do our part. Thank you and miigwech. And now, without further ado, the RNAO presents the power of strong clinical placements in long-term care.
Okay, just making sure everyone can, I don't know what's going on with my.
That's very I don't know, I sent a message. But...
And if everyone could mute their lines, please, that would be great. Today on RNAO's webinar, it's why nursing students aren't excited about clinical placements in long-term care. That has everyone talking. Today, we discuss the power of clinical placements in long-term care with a panel of nurses giving their perspectives. You will hear from a former director of care who shares how successful student placements lead to her having a full staff complement. Then we share how long-term care best practice coordinators can support students and the homes to implement best practices. Plus, you will hear about resources RNAO has to make your life as a student and preceptor easier. We turn up the volume on this discussion. It all starts at RNAO, the power of strong clinical placements in long-term care. Happy Monday, everybody. Welcome to the power of strong clinical placements in long-term care. We have a lot to cover today. Blowing up in healthcare is the state of not enough nurses in long-term care. And the question today is, why are nursing students not excited about doing clinical placements in long-term care? Let's react to this. My name is Connie Wood, a registered nurse with the Long-Term Care Best Practices Program. Along with 14 other registered nurses, I work as a best practice coordinator, supporting long-term care homes to implement best practice. With me today is my colleague, Jennifer Pahoon, and Janet Chi, our Associate Director of the Long-Term Care Best Practices Program. And behind the scenes is our Salali doing her magic with all the technical work. So let's get this conversation underway. I want to hear from you. Who in the audience has been a nursing student? Can you give me a thumbs up? Any thumbs up?
All right, Connie, so we've got 142 people on right now.
Holy.
And oh, I'm seeing lots of thumbs up now.
So we've got lots of people who's been a nursing student. That's great because I really want to hear from you. So I'm really curious to know, what's your name? Where'd you go to nursing school? And I always ask this wherever I go. I received my diploma in nursing from Durham College and then did my undergrad at Lakehead and my master's at Athabasca. Where's everyone from, Jen?
So we've got people from Queens, Brock University, Fleming
Excellent.
College,
Oh, I
McMaster,
like that.
Ryerson, University of Ottawa,
UOIT,
Algonquin
good.
College. Yeah, it looks like from all
Another
over the
from
place.
Lakehead.
Even some from Laurentian. There's one from BC. University of
Perfect. Well, thanks
Manitoba.
for sharing. It's wonderful to get to know a little bit more about our audience. Well, let's continue our discussion. Solali's going to post a poll, and I would like you to select your answers. So why are nursing students not excited about doing clinical placements in long-term care? What are your thoughts? You know, are they thinking the pace is too slow? Are they concerned there may not be opportunities for skill development? Or maybe they're just really unsure of what long-term care has to offer, or they've heard negative stories, or if you can think of something else, please put it in the chat box. And we're seeing a lot of people selecting that they're concerned they may not get the opportunities for skill development. Okay.
There
What
are
are
a
you
few
seeing in the
comments.
chat?
Yeah, I was gonna say there's a few comments in the chat. Ageism, culture, society,
Yeah,
the general poor state of long-term care. Some think it's boring. Some already work in long-term care as RPNs. Feel it's all PSW work, not nursing based
oh
on previous
yes, I've heard that.
experiences. Stigmas, overworked, lack of support. It's not
Okay.
exciting. It's not sexy work.
Yeah, I've heard that one. Yes. Okay.
It looks like we've got
Thank you.
75% answered there. And yeah, it looks like the majority, 77% are concerned there may not be enough opportunities for skill development.
For skill development. Okay, yeah. Okay, well, thank you very much for doing our poll for us and putting your thoughts in our chat box, because that's what adds to our conversation today. I'm trying to share the, okay. So let's just continue our discussion. With us today is a group of registered nurses experienced with clinical placements in long-term care. I want to get their thoughts on our panel question. So we have Christina Paluno, who's joining us, and Christina is completed her 4th year nursing clinical placement at a long-term care. And she shared with me that she just absolutely loved it. Now, Christina works with us at RNAO as a nursing policy analyst, and her portfolio includes long-term care and senior care. Also with us, welcome, Christina. Also with us is Alanna Mcdivitt, the Associate Director of Care at Spencer House in Aurelia. Alanna is a preceptor for nursing students and has been for several years. Her teachings focus on clinical skill development and leadership competencies. Alanna enjoys learning and expanding her own nursing knowledge, which she shares with nursing students. And from Trent University is Amy Kelly. Amy's a nursing placement coordinator at Trent, and Amy hears all kinds of stories about why students prefer to not have long-term care for their clinical placement, especially in their consolidation. And Amy has a passion for working closely with students and loves seeing them find their path in a career that offers so many opportunities. So welcome, Christina, Alanna, and Amy. It's great to have you here to discuss this really important topic. Ladies, you heard what the panel had to say. What are your thoughts to our audience's take on why are nursing students not excited about doing clinical placement in long-term care?
I can go if you'd like. I think one of the things as a placement coordinator that I hear is what the audience kind of showed in that poll is that students are afraid they're going to miss out on skill development. And they really see that as something that really happens for the most part in a hospital setting. And so there's a lot of, I try to have conversations to try to help them see outside of that. But I think the other thing too, more recently with COVID, and again, somebody I think mentioned it in the chat, was just kind of the reputation that long-term care has more so recently, right? We saw so much of that with when COVID kind of started and the outbreaks that were happening. And then there was talk of the care that was being provided and those investigations and things like that. So I think, you know, in general, I don't think it has, sadly, doesn't have the greatest reputation that draws the students into that. And they don't see the other pieces, like working with that older population, as something that they have been striving to do, right? And so I think some of them are uncomfortable with working with that population too, right? I think a lot of young people tend to, and myself included, even though I'm not that young, tend to use, you know, electronics to communicate with each other. And so when it comes into that face-to-face communication with people who aren't, with a population that really isn't familiar with that way of communicating, it really comes to light that, you know, there's lots of work to do there. So that's my thoughts anyways.
Thanks, Amy.
Mm-hmm.
Can chime in from a student's perspective if you like. So yes, echoing Amy's thoughts and our colleagues who weighed in through the poll, that was definitely my experience as a nursing student. I tended to keep a little bit more of an open mind about long-term care, but a lot of my colleagues had the perception that if they were placed in long-term care, particularly in their 4th year, that they would not have the same opportunities to build their skills as a student, nor to even go into acute care afterwards. They felt that that would not make them marketable as a student if they were placed in long-term care.
Yeah.
And so I think that was a huge concern for a lot of my colleagues who were placed in long-term care. But really what I learned is that's simply not the case, and that, you know, as our long-term care residents are becoming increasingly complex, the opportunity to build skills is completely there. So, but yeah, so echoing a lot of the thoughts that our colleagues have shared, that was definitely my experience as well as a nursing student.
And going off of what Amy and Christina said, I think most nurses are still coming out of school very focused on working on the hospital, but I think that even the general public are putting so much emphasis on hospital nurses, and they are the higher standard for nursing. So I think in order to maybe expel that myth, everybody needs to do a better job in promoting all sectors of nursing, and it should maybe even start from the educational facilities themselves.
Yeah, oh, thanks, Amy, or Alanna, sorry. And that leads into my next question. What are your thoughts then on how nursing students can be encouraged to choose long-term care clinical placements? How can we encourage it?
For me, I think that's just like Alanna just mentioned. I think schools, educators, and even fellow nurses and peers must frame long-term care placements, especially long-term care placements at the senior level for baccalaureate nursing students, as being truly valuable learning opportunities where you can actually practice a large, wide range of unique clinical skills and learn and grow. And I think that it makes you marketable for any type of position that you're looking to attain after graduation. And so I think if it's framed that way, especially starting at the educational level, it would open a lot of students' minds up to the possibilities. So.
Yeah, thank you.
I also think that long-term care has a lot of opportunities to learn and grow, but they're not promoted as well as they should be. For example, learning to problem solve, multitasking, critical thinking, and even developing leadership skills. And they may think that we don't have the skills to provide them for dealing with acute residents, but we are seeing an influx of patients with acute conditions. And as our population is growing, they'll continue to see this, which will require them to use their nursing skills that they learn in school. And long-term care is a great place to practice their assessment skills, as we both have well as frail elders. So they'll have a difference in how to apply their skills. And I also,
that's so right. Yeah.
And I was going to say, long-term care also allows you to develop those therapeutic relationships with your patients because you're caring for them on a daily basis. Whereas in the hospital, your schedule is always changing. The patients are in and out all the time. So it could be a different assignment every day.
Okay.
One thought that I have, sorry, Connie, was just that,
Yes.
that I think students need to have a clear understanding of what the role of an RN is. So if even somebody had just mentioned, and I just pulled the chat up because I saw it kind of flash by me, that their first placement is in long-term care where they're doing ADLs, right? Those just the basic kind of skills and things that the residents need to get going. And so that's what they think that job is going to be, right? Because that's their experience in it. So, and others have mentioned, I think it's part of our role as educators in our institutions is to help them see what that role really is, that it isn't just, there will be some of that, there will be some of that care that you need to provide, but that there's going to be lots of other opportunities that they may not have had that they haven't seen, right? And that they didn't have that experience with. And I think that's one of the key things that I see, because our placement in first year at Trent University is in long-term care, and it's a lot of the therapeutic relationships and a lot of that, those simpler tasks, but then they don't have that opportunity in the same way to see the vast opportunities that are out there. Yeah.
That's a good point too. Okay, this is a great conversation, girls, but I'm just wondering now, what do you see is the biggest challenge in placing students in long-term care at the moment, like during COVID? Like, what's been hard about it?
One of the things that I've noticed is that a lot of our students have to work as well as do placement. And then there's, with outbreaks with COVID, then there's limitations sometimes, right? And they can't work in a different institution than what they're placed in. So then they have to choose between hours at placement and hours at their job, right? And the job is so important to be able to get through their education, and then they can't get through their education if they're not doing their clinical hours, right? So that can be one of the, I think we saw that really highlighted in our first year placement this year. It was the first time that we tried to go back into long-term care, and there was a lot of missed time because of outbreaks and that sort of thing. So I would say that's probably one of the biggest things that I see from my perspective. And then again, like I had mentioned as well, I think just the reputation right now, having been highlighted in long-term care with COVID being so much on the news, that I think that it's kind of left an unsettling feeling for some.
Okay, yes, thank you. And Alanna, I wanted to ask you specifically, what are some of the ways Preceptors from Spencer House is making a difference in nursing education?
Well, we like to make sure that they have a great experience from the moment they walk in the door. It's all about being organized and enthusiastic. From a student's perspective, it's great to feel welcome, wanted, and supported. From there, we make sure that they're exposed to as many different roles and opportunities as possible. For example, I'm the fall lead in my care community, and I have a student with me for a couple weeks. And then after that, they'll go on to the skin and wound lead, and then the infection control lead, as well as the nurse manager. So the flexibility of this allows them to see a variety of roles, and instead of being stuck with just one. And then it also gives them a well-rounded experience of what long-term care really is.
And that experience of being with different nurses to see how different styles, I guess, of nursing, and learn just that a different opportunity to learn.
Yeah, and I think
that sounds great.
I think different preceptors have different learning or teaching methods as well, so they get to see variety in that way too.
Yeah. Now, Christina, you and I have had a conversation, and I know you just loved your experience as a nursing student in long-term care. So we've got lots of students out there, I think, listening. I want to know, what advice do you have for a nursing student who's hesitant about choosing a student placement in long-term care? It certainly didn't stop your career.
For sure, it brought me so many wonderful places, and I'm so very grateful for that final practicum placement being in long-term care. I feel like I really got the most out of it. So if I were speaking to an apprehensive nursing student, what I would tell them is that there truly is so much to gain from a long-term care placement. I think a lot of the preconceived notions, especially the ones that Amy spoke to with regards to that first clinical placement, allowing misconceptions to be kind of precipitated among nursing students, but really, especially at the senior level, there's so much to gain. So for me, I remember caring for a variety of residents with complex care needs. They weren't very simple whatsoever. And you have the opportunity to learn so many things within the setting because of that. So no two residents are the same, and you're able to learn so much from the different experiences and needs. So it's really amazing in that way. I got to practice so many clinical nursing skills in that environment. So I was able to practice medication administration, injections, G tube care of complex wounds, which is really, really interesting, ostomy care, and so much more. And you'll also be able to build unique skills, which I think are very unique to this environment because of the fact that RNs are typically in the charge nurse role. So for me, my preceptor was a charge nurse, so I was able to build the skills in the leadership, the time management, delegation. And then I believe one of my colleagues also spoke about the fact that you have the unique opportunity to build those deep and meaningful therapeutic relationships with your residents, because you see them on a day-to-day basis. And so for people that appreciate that, it can be really special and rewarding, as well as family-centered care. So because of that longevity of those relationships, they're able to really interact with families, which I know I personally really enjoyed. So in a nutshell, these skills are amazing to learn, and it's such a great thing to be able to work in long-term care after these types of placements. I think these types of placements really shine the spotlight on these on long-term care homes and the benefits of working as a nurse in these homes. But also, if you're apprehensive and you don't know where you quite want to go with your career, I don't think it should deter one from pursuing these types of placements, because there are transferable skills to be gained. So
okay. And yeah, even emerge, right? I mean, you have residents have heart attacks, they have seizures, they have GI bleeds, you need to do head injuries. Yeah,
absolutely.
so there's that too.
Yeah.
Okay, so I'd like to each of you to comment on how has the clinical placements for nursing students changed in the past 5 years? And I think we've touched on some of it, but I remember the day when I worked in long-term care, it was, I always say, little old ladies wearing dentures. It's changed now. What are you seeing? What kind of diagnosis, Alanna?
There's all different types of diagnoses, anywhere from CHF to pneumonia. People are coming in with G tubes. And then, of course, there's the palliative care that we see very frequently as well.
Okay, yeah. And I'm just wondering, Amy, have you noticed anything that's about the clinical placement that's changed that you're able to tell the students?
Yeah, I think for me, the students have, they really do just come more, I think more so in the last couple of years, students really have come with a path in mind. They've come into nursing with already kind of like where they want to head. A lot of them do anyways. And so I think the more that we can highlight, and I'm having ideas as this conversation is actually taking place, but the more that we can highlight that role of the RN, because I think that has changed drastically from even, from when I graduated, and then even probably in the last 5 years, that role is becoming more complex. So I think if we can do a better job of showing what it is that they're doing. So even in first first year placement, maybe having them spend, you know, most of their time, you know, learning those skills, those kind of primary skills, for lack of a better word, but maybe having them spend some time with some of the great kind of care providers like Alanna has mentioned that she has there, right? The different kinds of leads and the different managers that might be around, so that they can see that and put it all together, as opposed to just have it focused in.
So
on
my
that.
last question to you ladies is, what is one piece of practical advice you would give to a student and their preceptor?
I have 3. Be open-minded, ask questions, and have fun while you're doing it, because fun will make it go, you know, even if you're not enjoying it, sometimes just if you're having fun while you're doing it, it makes it better. And it's okay to just go into it open-minded. And if it's not for you, that's okay too. But there's a lot of people, I think, that might be pleasantly surprised by what they might be able to experience in long-term care.
Okay. Alanna, do you have any advice, or Christina?
I think, as Amy was saying, is be open and try to have fun. Come into your placement with a great attitude. Long-term care does have skills that is transferable to any setting. So make the best of what you're doing. And if you come in at miserable, you'll leave miserable. But if you come in with an open and positive attitude, then you'll retain those skills for your future.
Thank you.
At the top of my list as well of recommendations is also to keep an open mind. And I think that's what really allowed me to have a positive experience in long-term care as a student, was I kept an open mind. And the second thing I would say, especially for students, would be to seek out those learning opportunities. So there's so much to learn within the setting. And I found that I really benefited from seeking out learning opportunities. For example, I would ask my preceptor if I could participate in the weekly doctor's day visits to practice giving a report. I would ask to be part of any care conferences that were going on for residents.
Yeah.
I would ask to be part of the quality improvement initiative. So seeking out those extra learning opportunities can really make a difference in your experience, and you can find what interests you. So.
Okay, well, thank you. I'd like to open it up to our audience. And I think there's been lots in the chat box. Jen, do you want to, is there any questions? Does anyone want to unmute and ask our panelists any questions or have any comments?
Yeah, there's
If
been lots
you
of
want to
wonderful.
unmute, raise your hand.
So I was just saying, there's lots of amazing chat going on. Lots of comments about other ideas as to why long-term care isn't as attractive. Like, you know, it can be very intimidating to new grad for the amount of responsibilities available, which I think makes it even more imperative that there's that good mentorship for the placement side of things. There's different suggestions on approaches to take. There's a comment that someone really liked Alanna's approach. It was an excellent model.
Yes.
You know, some comments from teachers that, you know, that a lot of students do tend to go kicking and screaming into long-term care, but once they get in there, they actually realize all of the skills that they're able to build on, and like Christina had mentioned, had a really wonderful experience.
Okay, well, thank you, Alanna, Amy, and Christina, for enriching our webinar today. We appreciate.
Oh, Connie, we have, sorry, Connie, we have a question.
Oh.
Tracy.
Okay, go ahead, Tracy.
Yes, good afternoon, everybody, and thank you, ladies, for this discussion. My role, I'm a registered nurse, and it's very interesting to know that there are still at least perceptions that we are not still managing some of our residents or our clients within long-term care. So, you know, being sent into an emerge room, let's just say if they needed an antibiotic versus being treated in a home. And I was really hopeful that with the new role of nurse practitioners and maintaining skills and IV skills, that we would see more treatment of our residents in long-term care. I just have a question for everybody. Is that the new trend? Are we seeing more management within the homes versus having to send them to the ER department for some of these kind of treatments?
Alanna, do you want to comment on that?
Sure. I find that it depends on what the ailment is and at what stage of their disease progression that they're at. It's also a big conversation with the family as well, because if somebody can be started on oral antibiotics right away, then we wouldn't need to send them to the hospital. But if it's beyond that and the family haven't discussed care wishes and what they would like their family member to do, then ultimately it's the POA's decision to send them to the hospital, and we might have some of those. But indeed, we do try to mitigate any hospital transfers the best we can with our resources that we have available, but there's definitely times when we don't meet that need and they have to go.
And what's going on in the chat box, Jen?
Yeah, so there
I
are
think-
some comments as well, Tracy, just saying that they only send to ER when they can't manage symptoms in-house. There's one NP, it looks like, doing IVs and PICS and sub-Q hydration within the home. Lots of great stuff happening.
So it seems like it's a mixture out there of what homes are starting IVs and doing PICC lines. I know some of the homes I work with in the Peterborough area, I believe, are. So maybe it's just individual homes, but I think that's a good solution. Okay, I'm going to move ahead now. But thank you, everyone, for posing your questions and participating. This is a good conversation. So I had the pleasure to interview Jennifer Pahoon, a former director of care, about her solution to why students weren't interested in doing a consolidation in long-term care. And she's going to share how she prepared to have student placements. Here's what she had to say.
With me today is Jennifer Pahoon, a former director of care from a long-term care home in Aurelia. Ms. Pahoon is a strong advocate for introducing nursing students to a career in long-term care. Today, our conversation highlights her unique approach to enriching the learning opportunities for these students in long-term care. Welcome, Jennifer.
Thank you.
Let's talk about the elephant in the room. Anecdotally, I would say there is evidence of a continuing stigma about learning in long-term care among nursing students. But Ms. Pahoon, I understand students rate their clinical learning experience at Spencer House as positive and meaningful. I'm curious to know what it was about your approach that students liked.
Well, as a nurse, Connie, I'm sure you would agree an important aspect of the clinical placement is the application of skills and knowledge.
Oh, yes. I've been nursing for years and I can still recall my preceptor and some of my experiences.
Exactly. From my personal experience and talking to colleagues, I understand the importance of having a rich placement with lots of opportunities to learn and build on foundational knowledge. Positive experiences are critical in our growth as nurses. So when developing the placement program, I really tried to focus on creating that type of environment.
I often hear that having a student creates more work. When your team heard about your idea, what was their reaction?
You know, it's all about creating a mutually beneficial relationship. Aside from building on nursing foundations for the student, there are many benefits to the homes. Hosting students contribute to the learning and leadership within the home, and of course, the potential for retention and hire. So when looking at orientating a student as a new hire, it isn't that much work.
What do you say to the statement, I won't develop the same assessment skills and knowledge that I would if I do a placement in acute care setting?
You know what, Connie? I hear this all the time. So many students voice concerns that they're going to be behind their colleagues with acute care placements. Long-term care has changed.
That's for sure. I remember when residents were still driving and living in the home.
Exactly. There's a significant increase in the acuity of care residents require. The practice skills, collaboration, and leadership development obtained in long-term care may even exceed that in a hospital setting.
So your challenge was to create an exciting opportunity to entice RN students to embrace geriatrics and work in long-term care.
Yes, it was.
So how do you do this? What made learning at your organization different? Where did you start?
Well, I started by looking at the retention of students in general. PSW and RPN students were high. However, RN students weren't being retained after their placements. So this really made me take a step back and try and sort out what the barriers might be.
Interesting. So what are your thoughts and why was this happening?
Well, PSW and RPN students are introduced to long-term care early on in school, and they attend placements throughout their course. This enables them to understand their role and the skill sets required. RN students, on the other hand, they really have little to no exposure to the sector.
I see, it's true, yeah. I understand there's a brief long-term care rotation early on that places the RN students with a PSW to practice direct care. Yeah, I'm not sure if it allows students to see all that long-term care offers.
No, I don't think so either. So I completed interviews with students at the start of their placements and determined they really were all unsure of the RN role and scope of practice in long-term care.
Okay, so Jen, you have everything lined up with the schools and students are coming to the home. How did you select the preceptors?
So I decided I want to change our approach to preceptors. Instead of having one perspective of long-term care, I wanted to rotate the students and expose them to a variety of roles. The method I adopted was to change the students' mentors every 2 weeks. This would help the nursing students better understand long-term care and all the existing roles. Gives them lots of opportunities for growth and development. And another benefit to this approach was that no one team member had the responsibility or felt burdened by having a student for the entire 12-week rotation.
Okay, so creating a positive learning experience is really important to you. Changing the preceptors every 2 weeks sounds like a lot of work. How on earth did you make sure the students felt comfortable when they're, I don't know, they're kind of bouncing all over the home like that?
You know what, Connie? We work in a very collaborative environment within long-term care. So generally within the first 2 weeks, the students met each of the team members that they're going to be partnered with. And to be honest, from the feedback I've received, students really seem to enjoy that change of pace and scenery.
It does sound like a very structured approach to learning. Can you tell me more about the strategy you took to provide the students with some autonomy in their own learning?
So I wanted to ensure an individualized approach. My main objective was obviously to support their learning goals. So I would meet with each student, ask them to identify their learning goals as if they were in their preferred placement, and I would help them to determine how they could still meet those goals in long-term care.
Your strategy to showcase the similarities in nursing across all sectors is brilliant, Ms. Bahoud. What would the students' learning goals be?
Generally, students want to gain experience managing medically unstable patients, developing skills such as IV therapy and head-to-toe assessments. We also promote opportunities to build on skills like subcutaneous fluid infusion, catheter insertions, skin and wound care, and injections.
So lots of skill development. Could you share with me the life and a day of a student and give me kind of an overview of what the placement would look like.
For sure. So I would always start with building the foundation on direct resident care. So
Okay.
each placement begins with 2 weeks partnered with an RPN charge nurse, really to focus on and enhance those practice skills. During the next 2 weeks, the students would be partnered with an RN nurse manager, and this would
Okay.
expose them to the collaboration and critical thinking.
Wow.
So next, the students would follow the program leads, such as skin and wound, falls prevention, pain, IPAC, and continence.
Excellent.
Yeah, and the program leads in this home are also all associate directors of care, which means that the students also get firsthand experience in leadership development.
Brilliant.
So then the last 2 weeks are generally broken down into days with additional leadership members, just to further enhance the students' understanding of the Long-Term Care Homes Act and regulations.
Nice. Yeah, you really did take an approach to enhance their learning with this model. I'm really impressed. But are there any legal questions to consider or paperwork that needs to be completed? And just wondering, how did you find this and what was your approach to dealing with it?
So aside from the annual contracts, it's really on a student by student basis. Some corporations have HR or a talent acquisition team that would assist with collecting those required documents. But really, once the placement coordinators are aware of the home's requirements, they ensure all these documents are in place before the students even start.
Did you ever find team members a little hesitant to take on students because they weren't comfortable doing the evaluations?
Well, since I was already asking the team members to devote their time to teach and support, I would take on the responsibility of completing the learning plans and the evaluations.
Okay, so you mentioned that having a student placements benefited the home and the residents. Could you elaborate a little bit more on that statement?
Yeah, I feel it creates a learning environment for both students and preceptors. It builds confidence, encourages reflection, and really promotes opportunities for practice changes, which all in turn supports quality care for the residents.
Ms. Bethune, at RNAO's 2021 annual general meeting, Resolution 18 was passed, which calls for mandatory BSEM student placements in long-term cares. Do you think this would help enhance learning?
I do, Connie. Once I changed my approach to consolidation placements for RNs, we had a significant uptake in retention. This told me that we need to do a better job promoting long-term care within the learning institutions and providing wholesome learning experiences during placements.
Well, thank you, Ms. Bethune, for sharing with me the model that you use to enhance the learning opportunities for students. Obviously, it worked for you because you're able to retain your RNs and have a full staff complement. Wonderful news, and thank you. It was great having this conversation with you. Have a good day.
Thank you, you too.
When I heard Ms. Bethune's approach, I thought it to be really unique and well thought out. It's not a practice that, or a model that I've ever seen in my practice, and I thought this was really a creative solution. So do you think this is an approach that would work for you? Give me a thumbs up. I'm just wondering what you thought about her solution.
Well, and if I can add, Connie, keep in mind that this model can look different depending on the structure of the home you work in. And at the end of the day, the main goal is just showcasing the variety of roles and opportunities within long-term care. So I am seeing a few thumbs up.
Okay. So I'm just wondering, how can we flip this? How can we make long-term care more enticing to students? And I'm just wondering if You could share in the chat box. What are you doing? What's working for you? Or what thoughts do you have? How can we co-create strong clinical placements in long-term care? Jen, are you seeing any solutions? We want to hear from you. What's working? So please unmute yourself, raise your hand, or type in the chat and share your thoughts.
So another interesting comment from Karina is that it's interesting because you could even increase your capacity to take on more students as they could rotate through the positions in different order, which is exactly what we did. Because I know some people commented earlier in the chat that you know, there's obviously way more PSWs and RPNs in long-term care, and that, you know, sometimes some shifts there's only one RN on duty. So this is something we would do that would allow us to take 3 to 4 RN students at a time, which, you know, really worked with that collaboration with themselves as students with their learning and growth, as well as giving them lots of opportunities throughout the home.
Okay. So RNAO has been working on solutions, and joining us now is Janet Chi to explain how RNAO can support students, preceptors, educators, and the long-term care homes with the learning journey.
Thank you very much, Connie. You know, I am just so pleased. There's so many wonderful comments in the chats. So please continue to share your ideas. We love to hear them and amongst ourselves as well. So I'll tell you a little bit about the Best Practices program that has brought you this webinar today. We're a funded program by the Government of Ontario, and our purpose is really to support the 626 long-term care homes across the province to implement evidence-based practices to really improve resident care outcomes. And we do this through our little army of 14 long-term care coordinators across our province. So we have 14 long-term care coordinators that are really experts in long-term care, former DOCs, administrators with lots and lots of experience, and they are spread out throughout our province. And so their role is to connect with homes, to support implementation, but also to support clinical placements as well. And so we have coordinators that often go and speak at universities or colleges about best practices, how to implement them. We also have the ability to connect with our homes that we're working with to brainstorm ideas for placements. And so here today, we've heard of quite a few. There's also opportunities to support projects like implementing guidelines. Our coordinators can work with students and staff from the home to do gap analysis and develop action plans. I've heard of many students developing things like videos and education to provide to long-term care home staff. And so there are a lot of variety of ways that we as a team, our 14 coordinators, can support our long-term care homes. And here are just 2 really wonderful testimonials from Nancy and Ginny that, you know, that have shown that we are really supportive and helpful. And so feel free to reach out to us, connect with us. We would be happy to support academic institutions or our long-term care homes. And so this webinar is actually part of a larger program, the Nursing Student and Preceptor for Long-Term Care program. We've actually been working on this program for the last few months, and we have just launched it on Friday and again here today. And so if I can share my screen, Sitlali, I'd like to show you this page and just walk you through the many resources that we have. So I'm going to share my screen. Okay, so can you give me a thumbs up, Jennifer, if you can see this page? Okay, wonderful. So this is on our RNAO webpage. And here, new and upcoming, is this exact webinar. And so we will have this webinar recorded and we will be posting it here. So if you want to watch it again, or if you have colleagues that missed this webinar and you think, you know what, my friend Jenny should definitely watch this webinar, then just come over here and in a few days it will be posted. We also have a large number of resources for students and preceptors. And so if you click here on Preceptors of Nursing Students in Long-Term Care, it shows that we have created a 5-part video series for preceptors. Each video is about 8 minutes long, and it goes over a variety of topics, and the purpose is to encourage nurses to be preceptors. We know that oftentimes this is a challenge in long-term care homes, and so we have role of the preceptor, leadership and professionalism, communication, opportunities for preceptor, and then resources for preceptors. And so this is a great way to get a real introduction into what it means to be a preceptor. We've also created these videos for students. And so if you click here, this is really to provide students with a little bit of that orientation to long-term care before they start their placement, or while they've just started their placement. This could be part of their orientation. And so Alanna, certainly you can send your nursing students here to watch these videos. The first one we have here is the role of the student. The second is resident as the center of care, culture of long-term care, and opportunities. And so this is really about that myth busting about what long-term care is. And we've got some wonderful vignettes from key experts who are working in long-term care that share their experiences in both sets of videos. We also have here student and preceptor resources. And so if you click here, what we've done is we have like a top 5 for all of the key topics related to long-term care, because there are just so many resources out there that you can just go quickly to any of these topics. And I'll use falls as an example. And there's the top 5 key resources that students and preceptors could just hone into and to get an overview of falls. But then if you want more information about falls, you can go to our larger toolkit, which is on this site. You just go here to clinical topics. And then on the side here, we have all the clinical topics related to long-term care that we have guidelines. And you click on falls, and we have probably around 20 to about 20 some odd resources here that students and preceptors and long-term care home staff can access. And so this long-term care toolkit is maintained by our long-term care program. We check the links and the resources on a quarterly basis, so you can rest assured that all the resources here are the most recent and up to date. So, and this is free for anyone to utilize. And then we also have the toolkit, which I talked about. Here we have the Advanced Clinical Practice Fellowship Program. And so this is actually a program where nurses can apply for funding to work on a project. And that funding can be used towards their time for that project. And we have created a special fellowship specifically for long-term care to support long-term care homes to build clinical placements, to try out, to organize, just as Alanna had talked about, like how she's organized and Jennifer has organized their placements, make connections with schools, and then create a format for bringing students in. And so I encourage you, if you'd like to get some resources to build your clinical placement programs, the fellowship program is a wonderful opportunity. So all you have to do is click here and it'll go to this website, and it contains all the information you need in terms of the fellowship stream, the proposal process, and then the timelines. And so when you're looking down here, the next proposal RFP date is, let's see, RFP issue date will be May 13th. And then the intent for submission, so that RFP is already on this website, as you see down here. And then the application due date is July 27th. So I encourage you to have a look at these fellowship, and this might be a great opportunity. And then finally here is you've heard about our 14 long-term care coordinators. If you know who your long-term care coordinator is, just email them, connect with them. But if you're not sure and you want to know who it is, just click on this link and you will be connected with Satlali. Just email us your name, your email address, and say, this is the home I belong to. I'd like to know who my coordinator is, and we will get you connected. Okay, so that is our new website. And so I am going to go back to the presentation. Okay, thank you, Satlali. And so here we have, that's the program. We also have this wonderful page. It's called In Focus. We just developed it with a lot of resources about long-term care and what RNAO is doing to support long-term care, including this long-term care program. And so if you ever want a nice overview of what's happening, resources, webinars, articles from our policy department, we had Christina talking earlier. She is involved with developing a lot of wonderful resources and position statements, then come to this website. Now, this is another program we literally just launched on Friday, and we are developing a leadership and management for nurses program. This is a free education offering. It's really designed for nurses in managerial leader roles. It's a full day, 4 full day free sessions. We're going to be starting in September, and it is going to be focused on the core content from our leadership guideline. So it will be a modular format where we'll have core content for an hour. We'll have leadership in action. So we will have experts in long-term care coming in the leadership and action section to really talk about how to apply that core content to long-term care. And so we will actually have 2 streams. One is a long-term care stream and another is an acute care stream. And so our long-term care stream will separate out. And then we will also have another 1-hour session related to application and networking. And so this is where we'll have case studies, resources to talk about sharing and networking with colleagues, as well as a mentorship component. So I encourage you, applications will start June 1st for this new leadership and management program. And finally, for new nurses, we have and for actually anyone who's looking for a new role, we have our RN Careers website. So you just go to our RNAO site and there are lots of supports there for anyone looking for a new role. And so I'm going to hand it back to Connie to wrap up.
Thank you very much. So yes, this is our wrap up, and what a great discussion we have with our panel. Christina, who showed her enthusiasm about what it was like to be a student in long-term care. The perspective from Amy at Trent University for the students and how she encourages them to choose long-term care. And Alanna, her perspective from a preceptor and how she shares her knowledge. We had a great discussion, I thought, with a former director of care on how she developed a model that created a very, I think, a wonderful experience for her students who then were interested in applying for an RN job. You learned how the long-term care best practice coordinator can be supportive to preceptors and homes to assist the students learning. And a gift to you from RNAO, we showcased all the RNAO resources that could help you. I do thank you for taking the time out of your busy day. I certainly hope that we're challenging you to think about how you can come up with solutions. I think collectively we have to make our voice strong and share the news that lots can be learned in long-term care. It's changed to what it was a few years ago. There's really, it's really more like chronic care almost. So thank you, everyone. I really appreciate your attendance. But before we sign off, I'm just wondering if anyone in the audience has one more last thing to say, another comment they would like to make. You can unmute, you can share your thoughts or type it in the chat box. And we do have an evaluation there. We want to hear from you. Please complete our online evaluation form.
I just had
Anything
I just had one comment. So my name is Krista Massey. I'm from the University of Manitoba. So we are.
Wow, welcome.
Thank you. This was great. Thank you so much. So I'm the clinical coordinator. So I do all of our clinical placement coordination, and we are in the process with, because of nursing shortage, the government has approached us about program expansion, which I think lots of academic sites are doing the same across the nation. So one of the interesting things is that we run up against all of the other nursing academic sites in our clinical placements, and there's only so many spots you can go. And so our placements sites are limited. And so one of the things I've wondered about, and this was really good because it kind of helped me start to flesh out what this might look like. But again, we use long-term care placements for our very first clinical course, and then we never use it again. And yet that is one of the areas where we have tons of room to do, like to have clinical placement, right? Like we have so many long-term care centers in Winnipeg and in Manitoba that I think that if we started to figure out how we could meet the competencies and yeah, like how we could grow that and do more than what we're doing right now, I think that would be the area where we could actually expand our program. So this was super helpful. Thank you very much.
Oh, that's great. Yes, I really thought Jen's model of sitting down and talking to the students to see, well, what do you think you'd learn in acute care? And then she flipped it and applied it to long-term care. And I think that was really quite brilliant, actually. So
Well,
thanks for your remarks.
So Connie, I'm wondering, is this an opportunity for maybe Krista and Amy to be able to connect so that we can, share from one province to another, how to, grow clinical placements in the senior years? Amy, what do you think?
I just sent Krista my email address on the chat, so it's no worries. If she wants to reach out, we can chat, and she might have good ideas that we haven't used here too. So yeah,
well,
that's great.
This is what we were hoping for, because collectively with our voice, we can flip this. And I think this is the beginning of, making new steps forward. So there's the online evaluation. Please forward it. I thank everyone again for being so generous with your time today. Keep this conversation going. Thank you, everyone.
Thank you.